I want you to imagine an invisible force.
Yeah.
It is completely unseen, totally silent, but it's powerful enough to sweep through a community and keep like nearly a third of all students entirely out of the classroom.
Wow.
Yeah.
That's a massive number.
Right. And you can't put up a physical barrier to stop it, and you obviously can't just legislate it away. But right now, this force is keeping 28% of students completely out of the school building.
Just entirely gone.
Exactly. So today, we're doing a deep dive into the actual root cause of this chronic absenteeism. And we're going to explore a specific operational model in Georgia called MentalSpace School, which is honestly completely flipping the script on how we get kids back into the classroom.
It really is. I mean, it honestly feels like a ghost in the machine of our education system.
Yeah.
Because when you look at that 20% figure, which, by the way, is nearly double the pre-pandemic rates, you realize it completely breaks the fundamental math of how a school operates.
Oh, absolutely. A school simply cannot function, either academically or financially, when a third of its population is just missing.
Right. And the crazy part is, the traditional institutional responses have largely remained the same as they were, 50 years ago, even though the nature of the absence has fundamentally shifted.
Okay, let's unpack this, because I think this is where society's default setting gets us into a lot of trouble.
Oh, for sure.
It is so incredibly easy to fall into that kids these days narrative, right? The assumption that kids are just staring at their phones until 3 a.m., or that they have a fundamentally broken work ethic.
Right, or that there's just this epidemic of pure laziness.
Yes, but treating this modern scale of absenteeism with, like, a detention slip or a disciplinary hearing, it just completely misses the mechanism of what is actually happening.
It really does.
Think of it like driving down the highway when your car's check engine light starts flashing red. Responding with discipline is the equivalent of taking a piece of black electrical tape and just, sticking it right over the warning light.
That is such a good way to look at it.
Because you don't have to look at the flashing red anymore, but it completely ignores the fact that there is a catastrophic mechanical failure happening under the hood. The car is still going to break down.
Exactly. Regardless of how aggressively you enforce the tape.
Right.
And that is exactly the dynamic at play here.
Right.
Because you are addressing the empty desk while entirely ignoring the engine. And the data we have makes it undeniably clear that the hidden driver under the hood isn't laziness.
No.
It isn't some sudden generational moral failing. The actual mechanism driving this absenteeism is untreated mental health.
Which requires a completely different set of tools than a detention room.
Precisely. It forces a fundamental reframe in how we view the problem.
Okay.
We have to entirely stop asking the question, are they lazy? Or why won't they comply?
Right.
We have to replace it with a much more difficult but infinitely more accurate question. And that question is, what are they avoiding and why?
What are they avoiding and why?
Yeah. Think about how that single shift in questioning alters the entire reality of, say, a parent-teacher conference.
Oh, totally.
If a principal and a parent walk into a room operating under the premise that the child is lazy, the conversation is inherently adversarial.
Right. It's about enforcement and compliance.
Exactly. The school is demanding the parent discipline the child. But if the premise shifts to, your child is avoiding this environment, let's figure out what is triggering that biological avoidance, the temperature of the room drops immediately.
You're on the same team now.
Yes.
Yeah.
You instantly move from a punitive stance to a clinical supportive stance. You actually open the door for parents, school counselors, and clinicians to collaborate and look for support that actually fits this specific child.
So let's actually dig into the biology of that avoidance. Because it's one thing to accept the concept that they are avoiding school due to mental health. It's another to understand how that physically, mechanically manifests in the body. I want you to think about the biology of an anxious brain walking into a high school. Your brain, the very organ responsible for keeping you alive, has perceived a brick-and-mortar boarding as a literal physical threat to your survival.
It's pure instinct at that point.
Exactly. If your amygdala is flooding your system with cortisol, screaming at you that walking through those double doors is dangerous, forcing yourself inside isn't a matter of willpower.
No, not at all.
You are actively fighting millions of years of evolutionary biology. Your body is doing exactly what it was designed to do, which is keep you away from the tiger. Except in this case, the tiger is the cafeteria.
That's spot on. What's fascinating here is that the biological response is completely identical.
Really?
Yes. Whether it's a predator in the wild or just the complex social dynamics of a crowded hallway, the nervous system reacts the exact same way. When a child has an anxiety disorder, the school environment itself becomes the threat.
Wow.
The sudden jarring noise of a bell, the pressure of a pop quiz, the sheer sensory overload of hundreds of peers, these aren't just annoyances.
Right.
To an anxious brain, they are acute stressors that trigger an involuntary fight, flight, or freeze response. The avoidance isn't truancy. It is a biological retreat to safety.
And the mechanism is different for depression, right? Which I think is where the lazy label gets applied most unfairly.
Oh, absolutely. Because depression is so often fundamentally misunderstood as just a bad mood or like a behavioral
To
decision.
cheer up.
Yeah, exactly. But clinical depression is a physiological depletion of neurotransmitters. It's like trying to start a car when the battery is completely dead.
And yelling at the battery to try harder doesn't generate a spark.
Right. Depression severely impacts motor function, energy levels, and cognitive processing. Telling a severely depressed student to just get up and go to school ignores the fact that simply getting out of bed has been removed entirely from the realm of choice.
That's profound.
The structural capacity to initiate that action simply isn't there in that moment. We really have to stop viewing it as a lack of effort and start properly categorizing it as a clinical symptom.
Which brings us to the most complex layer of this, I think. Trauma.
Yes.
If anxiety is the brain's alarm system going off, trauma is what happens when that alarm gets permanently stuck in the on position.
That's a great way to describe it.
How does a student in that constant state of hypervigilance process a normal school day? We often think of school as a highly structured, neutral, safe space.
Right.
But for a student navigating trauma, the seemingly simple act of sitting still in a fluorescent-lit room for 7 hours can be an impossible physiological ask.
It really raises a vital point about sensory processing. Because trauma physically rewires the brain to be constantly scanning the environment for danger.
It changes the actual wiring.
Yes. The prefrontal cortex, which is the part of the brain responsible for logic, focus, and learning, essentially goes offline so the brainstem can prioritize survival.
Wow.
So you take a student operating in that state of high alert, you put them in a confined space, you put them under harsh, humming fluorescent lights that agitate the nervous system.
Which is pretty much every classroom.
Exactly. You surround them with unpredictable peer behavior. And then you demand that they sit perfectly still and focus on algebraic equations.
It's just a recipe for disaster.
Their nervous system cannot process that level of ambient sensory input while simultaneously managing the internal blaring alarm bells of trauma.
So as a practical matter, what does this actually mean for the schools trying to handle this? Because if you are a principal or a superintendent, you might completely understand everything we just discussed.
Sure.
You recognize the clinical barrier. You know that sitting in this fluorescent lit room is biologically overwhelming for a traumatized kid. But your mandate is education, not healthcare.
Exactly.
How on earth does a local school district deliver the necessary intensive therapy to these students without turning into a hospital?
And that is the exact systemic friction point we are facing nationally right now.
Yeah.
And it's precisely where the operational model of MentalSpace School comes in.
Right, the program in Georgia.
Yes. MentalSpace is a direct structural answer to this K-12 crisis. They aren't just offering a temporary Band-Aid or, handing a kid a referral sheet to an outside clinic.
Which usually just gets lost in a backpack anyway.
Exactly. They are providing a comprehensive, integrated clinical ecosystem right inside the school's framework.
Let's break down how that ecosystem actually functions day to day. Because typically a school has maybe 1 or 2 guidance counselors responsible for a caseload of, 500 to 1,000 students?
Right, and those traditional counselors are doing heroic work, but they are completely overwhelmed.
Oh, I can't even imagine.
They are managing class scheduling, college prep, standardized testing logistics, and just constantly putting out behavioral fires.
Yeah.
They don't have the time or often the specific clinical licensing to conduct deep, long-term trauma therapy. MentalSpace changes the model entirely by providing dedicated, licensed therapist teams for each specific school.
Wow.
And one of the most critical mechanisms they utilize is same-day teletherapy.
See, that immediate intervention completely short-circuits the escalation cycle.
It really does.
If a student is having a panic attack or a depressive crisis on a Tuesday morning, handing them a slip of paper for an appointment 3 weeks from Thursday is completely useless. The crisis is happening now.
Exactly.
So how does that same-day access actually look in practice?
It is all about immediate triage, where the student already is. Instead of the student leaving the building, traveling to a clinic, and missing the entire school day, the intervention happens on site.
Right there in the school.
Yes, the student might go to a designated quiet room, open a secure tablet, and be instantly connected to a licensed clinician who already knows their file and their history.
Oh, that's amazing.
They can de-escalate the immediate anxiety, conduct crisis intervention, or enact specific suicide and violence prevention protocols right in that moment.
And they don't even have to leave campus.
Right. The student receives the clinical care they need and, in many cases, can actually return to class once their nervous system has regulated.
But the part of their operational blueprint that I found most compelling from the text is that they don't treat the student as an isolated island. MentalSpace also integrates staff wellness programs and family counseling.
Yes, which is so important.
It's logically vital. You can't just parachute a clinician in for a 45-minute session, regulate the child's nervous system, and then send them right back into a highly stressed classroom with a burnt-out teacher.
Exactly.
Or send them home to a family dynamic that might literally be the source of the trauma.
A child is a product of their environment. Treating the teachers and the family builds a necessary scaffolding of support around the student.
Yeah.
If we go back to the reframe we discussed earlier, the idea of finding support that actually fits the child, that holistic environmental approach is mandatory.
Totally.
And part of ensuring the support fits the child is looking at exactly who is delivering the care. The MentalSpace staffing model is extremely deliberate about this.
How so?
Well, their therapists are, of course, fully licensed, but the model explicitly prioritizes diverse and culturally competent care teams.
And culturally competent care is a term that gets thrown around a lot in healthcare administration. Why is it functionally necessary here rather than just being a buzzword?
Because the entire mechanism of therapy relies on profound trust.
Right.
If a student from a marginalized background is struggling with complex trauma related to their identity, or if a family has a generational historical distrust of medical institutions, a culturally competent therapist bridges that gap.
That makes total sense.
They understand the specific cultural nuances, the family structures, and the societal pressures of the community they are serving.
They speak the same cultural language, essentially.
Yes, they aren't just copy-pasting generic psychological principles. They are translating that clinical care through a lens that the student actually understands and resonates with. That translation is what makes the therapy effective rather than just available.
Okay, I have to jump in here and ask the obvious logistical question.
I know what you're going to ask.
As a taxpayer, I hear comprehensive, culturally competent therapy teams with same-day telehealth access. And my immediate thought is, our local schools can barely afford new textbooks.
Right.
They are struggling to keep the heat running in the winter. Mental health care is notoriously expensive. How on earth is a public school paying clinical rates for this kind of infrastructure?
It is the single most important question. Because a brilliant clinical model that bankrupts a school district isn't a solution.
Exactly.
But the way MentalSpace structurally handles the financing is what makes the model sustainable. They aren't asking the school to pay for this out of the general education fund.
So how does the billing actually work?
They shift the financial burden away from the school district and entirely into the healthcare system where it belongs.
Oh, wow.
Yeah. MentalSpace has built an administrative infrastructure to weave together state funding, Medicaid, and private insurance.
So what does that look like for the families?
For Medicaid patients, the cost to the family is $0.
Wait, completely covered?
Completely covered. No out-of-pocket fees.
That's incredible.
And for families with private insurance, they process claims across a massive range of providers. The text explicitly lists Blue Cross Blue Shield, Cigna, Aetna, United Healthcare, Humana, Peach State, CareSource, and Amerigroup.
That is a huge list.
Right. They operate as a specialized healthcare provider that just happens to be embedded in the school, shielding the core education budget from the cost of psychiatric care.
Which solves the financial friction. But what about the legal friction? You have two massive, notoriously rigid bureaucracies colliding here. The American healthcare system and the public education system.
Oh, the red tape is usually a nightmare.
Right. Normally, a school counselor can't easily coordinate with a private doctor because of strict federal privacy laws. FERPA protects a student's educational records, and HIPAA protects their medical records. Those two silos usually aren't legally allowed to talk to each other without a mountain of paperwork.
And that red tape is exactly what usually prevents comprehensive care. But MentalSpace operates as a fully HIPAA and FERPA compliant bridge. Because their clinicians are integrated into the school's operational framework, with the proper parental consents and data security protocols already established, the math teacher, the school counselor, and the clinical therapist can actually coordinate.
Which is huge for the kid.
Absolutely.
Yeah.
If a student is placed on a new anxiety medication that might cause drowsiness in the mornings, the therapist can securely relay that specific, necessary context to the school without violating medical privacy. The legal bridge is built into the model.
By the way, for anyone listening in Georgia who is dealing with this in their own district, we should mention that you can look at their framework directly at mentalspaceschool.com or reach out to their team at mentalspaceschool at chititherapy.com.
Highly recommend checking it out.
Because when you remove the financial barrier and you solve the bureaucratic friction between HIPAA and FERPA, you get to the actual outcomes. And the data here is what makes this entire model so vital.
It really is.
When you stop punishing the symptom with detention and start aggressively, holistically treating the root cause with $0 barriers, the transformation is profound. MentalSpace achieves an 89% rate of improved attendance among participating students.
89%. I mean, you are taking students who had entirely abandoned the educational system and bringing almost 9 out of 10 of them back into the classroom.
And they are coming back healthier. That attendance rate is accompanied by a 92% reduction in anxiety and an 85% family satisfaction rate.
Which is just staggering.
They aren't just dragging the kids back into the building against their will. They are regulating their nervous system so they can actually learn while ensuring their families feel supported by the district rather than targeted by it.
Which ultimately proves the core thesis we started with. These students weren't irreparably broken. They weren't a lost generation of lazy kids lacking a work ethic. They were physiologically overwhelmed, clinically untreated, and avoiding an environment their brains perceive as hostile. The moment you treat the engine, the flashing warning light turns off on its own.
So let's summarize the ground we've covered today. We started by looking at a massive systemic crisis, a 28% chronic absenteeism rate that is quietly hollowing out our schools.
Right.
We discovered that beneath the cultural assumptions of laziness, the true mechanism driving those empty desks is untreated mental health.
Exactly.
We explored the biological reality of how anxiety, depression, and trauma physically manifest in the body, rendering standard disciplinary measures totally useless. And finally, we looked at how a holistic, highly accessible model like MentalSpace School in Georgia is turning those numbers around.
By treating the entire ecosystem of the student, the staff, and the family.
Yes, while navigating the complex realities of insurance and federal privacy laws.
It is a remarkable testament to what happens when we are willing to change the questions we ask. And that brings me to a final thought I want to leave you with today.
Let's hear it.
We spent this entire discussion focusing on the educational system. But think about that core psychological shift we discussed at the very beginning. It's simply shifting the question from "are they lazy?" to "what are they avoiding and why?" can successfully rescue the education of a failing student.
Yeah.
What other areas of your own life might completely transform if you applied that exact same clinical curiosity to yourself?
Oh, wow.
Perhaps there is a massive project at work you have been endlessly procrastinating on, or a personal habit you just can't seem to break despite your best intentions. What if you aren't lazy either? What if that invisible force of biological avoidance is at work in you, and instead of punishing yourself, you just need to pop the hood and look at the engine?
That is definitely something to think about. Thank you for joining us, and we will catch you on the next deep dive.